This is Tim Lipsey, System Vice President, Environmental Services for CommonSpirit Health. I would like to thank you for joining us for the Equip training series. Education and demonstration are key elements of being a professional environmental services technician. We say hello to human kindness by providing a clean, safe environment as we help save lives. It is our contribution to the healing ministry. It's the CommonSpirit way.
Our vision is to create a highly equipped and highly engaged environmental services team using evidence-based techniques, processes, and mission metrics to ensure we provide a clean and safe environment. We help save lives. We do this through the acronym EQUIP, educating our people to provide quality service delivery by understanding deliverables and serving others with integrity while pursuing excellence.
Welcome to the OR Terminal Cleaning Standard Work Operating Procedures. Always follow the invasive cart setup according to your standard work operating procedures. Prior to entering and exiting the OR theater, always perform hand hygiene in accordance with the CDC and facility protocols. EVS cannot enter a surgical room until the patient has been removed. Always wear restricted area clothing or PPE according to AORN guidelines prior to entering the surgical area. Always wear attire that has been healthcare accredited laundry. Always lock your EVS cart when it's out of sight. Prior to performing your cleaning and disinfection according to the AORN guidelines, always check the surgical area first to assess what work needs to be performed. Place a wet floor sign at the door to mark that the room is in progress. See your STAR guide for instructions. STAR stands for Safety, Training, and Responsibility. Door should remain closed when not in use. Always perform hand hygiene upon entering or exiting the area you are cleaning. When performing hand hygiene, always follow the CDC and facility guidelines. Don a fresh set of gloves and ensure they properly fit. Always check for holes or any breakage in your gloves. Next step is to remove trash and soiled linen. When removing trash, remove large debris. Gather trash and linen, always consolidating when applicable. Regulated waste must be separated for transport. When tying all trash bags, use a gooseneck knot to secure the bag. Perform safe lifting and handling techniques. When carrying the trash, carry it away from your body, remaining careful of sharps at all times. Place trash in a covered container at the door. Next step is to remove the linen. Consolidate all linen at the door. Secure the linen bag by tying a gooseneck knot to the top of the bag. Remove the bag through the side to avoid lifting injuries. Always carry away from your body, remaining careful of sharps at all times. Place the linen in a covered container at the door. Next step is to damp high dust. Select one ultra microfiber high duster sleeve and dip it in the disinfectant in the labeled red bucket. Express the liquid until there are no more drips. Only one microfiber high duster sleeve can be used in one OR prior to being replaced. Place the microfiber high duster sleeve on the high duster handle. After slipping the sleeve on, fix the Velcro. Close the procedure room door. Always damp high dust starting at the door. Start at the door, end at the door. Follow a clockwise or counterclockwise path around the procedure room. Damp high dust all high items eye level and above, all horizontal and vertical surfaces. Damp high dust all items that are eye level and above that include but are not limited to ceiling, light panels, air intake grills, top of blanket warmers, behind stationary equipment, ledges, high vents, any fixed and ceiling mounted equipment that cannot be reached, all other ceiling surfaces. Damp high duster frame is designed to be bent to its desired shape for cleaning and disinfecting all surfaces. If you recognize that the high duster handle is not extended to a safe, ergonomically comfortable position, extend the pole as needed to prevent overreaching. Cleaning vents always clean in the same fashion or following the same principles from the AAG practice guidance. Top to bottom, cleanest to dirtiest, and clockwise counterclockwise. When cleaning vents, follow unidirectional path or a singular motion or same direction. This avoids spreading pathogens. In an intentional and deliberate manner, apply consistent pressure to the microfiber high duster sleeve. Protruding surfaces on the walls should be cleaned and disinfected carefully. All horizontal ledges, above light fixtures, all cracks and crevices, behind TVs and monitors, be alert and remain careful not to unplug or disconnect any devices. When cleaning ceiling lights, follow the same principles in a unidirectional format, applying consistent pressure. When cleaning walls, ensure the flat portion of the microfiber high duster sleeve is carefully pressed against the wall, cleaning in an S fashion. Get all areas high above doors carefully and thoroughly damp dusting all ledges. Bend high duster sleeve to the desired shape as needed. Continue damp high dusting above doors carefully and thoroughly, damp dusting all ledges. Now that you've completed all damp high dusting, visually inspect the room. Go back and get any other areas that you may have missed. Damp high dusting, lights and booms is discussed in the AORN Environmental Cleaning Guidelines Section 4.1. You are cleaning and disinfecting a sensitive area for patient safety. Carefully and methodically clean all surfaces of the booms, horizontal and vertical, applying consistent pressure, remembering that physical, mechanical action and scrubbing is a part of the disinfecting process. Adjust all monitors so that every area of the boom and lights are accessible and can be easily reached. Areas that may be missed can pose a hazard to patient safety and health. Apply consistent pressure and always clean it like you mean it. Finish high dusting, remove the high duster sleeve and place it in the cart. Place the high duster handle by the door to be disinfected at a later point. When complete, perform hand hygiene, another excellent opportunity to control pathogens. Don fresh set of gloves. Ensure proper fit and check for holes. Now it's time to clean and disinfect the perimeter equipment. Collect a minimum of 4 blue disinfectant cleaner charged wipers from the cart. Collecting 4 blue microfiber wipers, submerge each wiper into the disinfectant and express the liquid until there is no more dripping. Close the cover on the cart. We will now place 1 wiper at the start of each wall along the path that you will be following through the room. This intentional, well thought out planning ensures that you have a wipe that is fresh and clean at each place where you transition areas within the room. This ensures best infection prevention standards and guidelines are met. The last remaining towel in your hand, fold it in half and half again for adequate palm pressure. The cleaning is methodical. By starting at the door and ending at the door, we ensure that no areas are missed. All equipment will be cleaned top to bottom in a unidirectional or intentional figure 8 or S-stroke manner. Items will include all horizontal and vertical surfaces and light switches, ledges, and any items that protrude from the wall. These items will include but are not limited to tables, IV poles, pumps, suction machines, monitor frames, Mayo stands, stools, chairs, trash and linen receptacles, keyboards, Bovie machine, counters, cabinet doors, doorknobs, wall vents, and things like these. Always ensure that telephone and high-touch surface areas, keypads, and handsets are properly cleaned and disinfected. Use one side of the wiper to clean and disinfect a separate surface for a total of 8 surfaces per wiper. Each piece of equipment will be moved to the center of the room as it is cleaned. Each item should be cleaned from top to bottom, cleanest to dirtiest, in a clockwise or counterclockwise format, using the S stroke when using the wiper, with effective palm pressure. utilizing the S stroke, clean from top to bottom all medical equipment, from the cleanest to the dirtiest. Please note the flat palm pressure that is critical to the friction and mechanical cleaning and disinfection process. This ensures that pathogens are trapped, captured, and removed with your healthcare grade ultra microfiber wipes. Once the equipment has been cleaned and disinfected, it will remain in the center of the room until the walls and the perimeter floors have been cleaned and disinfected. When cleaning IV poles, clean them in the same manner with the same principles in mind from top to bottom, cleanest to dirtiest, and in a unidirectional wiping pattern. Notice and pay particular attention to the grip and the pressure that is applied as you go down the IV pole, ensuring that no surfaces are missed and that any things that are protruding, such as knobs and adjustment handles, are wiped and cleaned and disinfected properly. As we clean from top to bottom on the IV pole, we're careful not to forget the legs, the top, the sides, the underneath, and of course, the wheels. The wheels are last, but not forgotten. Remember, each piece of equipment will be moved toward the center of the room as it is cleaned. Once the equipment has been cleaned and disinfected, it will remain in the center of the room until the walls and the perimeter floors have been cleaned and disinfected. As you move along the wall, pull each finished piece towards the center of the room. Then proceed on to the next piece of equipment. Refold your towel so that there is a clean, fresh side exposed so there is no cross-contamination. Pay particular attention to the effectiveness of cleaning the linen stand. By staying or standing in one place and rotating the stand in a clockwise or counterclockwise direction while cleaning each stand pole or leg. Then, switch to a fresh side of your microfiber wiper and wipe the base in an S-stroke motion, always with the leading edge and correct palm pressure. After cleaning the last piece of equipment on the wall, set it to the center of the room and move over to wipe all supply doors, cabinets, handles, hinges, and high-touch areas. Use extra pressure and vigorously scrub and clean, knowing that these are high-touch areas. Incomplete, refold wiper exposing a fresh clean side to reduce contamination, and move to the door, including all hinges, ledges, and handles. Always clean from top to bottom, and when transitioning to door handles, especially high-touch surfaces, apply extra added pressure to ensure physical and mechanical removal of soil and contaminants. Switch to a fresh clean side of the towel when transitioning to new objects, items, or devices. Items requiring extra attention are frequently touched or high-touch surfaces, especially hand sanitizer dispensers. Clean from top to bottom in an S motion, putting extra pressure on areas that receive physical contact, such as the pump handle. Wipe the drip tray and make sure to check the date to ensure that it is not expired. When transitioning to a new device, surface, or wall item, refold the towel for a fresh, clean surface to reduce any cross-contamination. Avoid all protruding items on the walls. Focus on ledges, nooks, and hidden surfaces where pathogens hang out. Computer workstations and keyboards require extra attention in cleaning as these come in contact with soiled and dirty hands more frequently. Always pay attention to manufacturer's instructions for use for proper cleaning and disinfection of medical devices and equipment, especially electronics, as these may require special care, handling, and attention. Once again, pay extra attention to hand sanitizer dispensers on areas that come in contact with human hands and wipe the drip tray. Check the expiration date, make sure it has not expired. Always perform hand hygiene whenever entering or exiting the environment of care. Make sure to follow the CDC and local facility guidelines for proper techniques. Always don a fresh set of gloves, ensuring that there are no holes or punctures or tears. Next, wall cleaning and disinfection. At this time, collect your mop handle and frame and 2 disinfectant-charged blue microfiber mops. You will place one mop at the opposite end of the room on the clean table in front of the wall opposite the door based on the clockwise counterclockwise path you will be following through the room. Clean the walls from top to bottom. This motion ensures that the cleaning and disinfection of all walls, vents, cabinet doors, and wall-mounted equipment is not missed. Pay particular attention to items that are mounted on the wall so as not to break them by bumping into them. Notice now that there is unidirectional path in the movement on the wall washing. This is very similar to the mopping that you do on the floor or the wiping with the microfiber towels. There is a leading edge, and this leading edge and consistent pressure ensures complete microbial removal of any pathogens that may be present on environmental surfaces. This is an infection prevention best practice. By following the path around the room in a methodical manner, we are ensuring that no items are missed, no walls are missed. All cleaning and disinfection by using a unidirectional path is an infection prevention best practice and held out by the authorities having jurisdiction such as AORN, Environmental Guidelines for Infection Control in Perioperative or Invasive Settings, and the American Hospital Association's Personal Membership Group, AAG, the Association for the Healthcare Environment. Now that you have arrived at your midway point on your third wall or halfway through the room, remove the soiled microfiber mop. Place it on the floor. Take the clean microfiber mop that you placed earlier on the table at the opposite end of the room and place it back on the microfiber frame and continue on your third wall. Following the same principles from top to bottom and unidirectional pathway. Make sure to include the door as you progress along the wall. You have now reached your fourth and final wall. You will continue the same process as you've worked your way around the room. From top to bottom, cleanest to dirtiest, and a unidirectional pathway ensures that no items are missed. You are now approaching the end of your fourth and final wall. Now we've completed wall cleaning and disinfection. Be sure to remove the soiled microfiber mop. Leave the handle and frame in the room for the next step. Please collect soiled microfiber mops and return to the appropriate location on the cart. Perform hand hygiene in accordance with the CDC and facility guidelines. Don fresh gloves or PPE, ensuring that there are no cracks, tears, or puncture holes. Next, we will perform perimeter floor cleaning and disinfection. Collect the microfiber mop and handle from the cart. Obtain 2 blue disinfectant cleaner charged microfiber wet mops. These will be placed around the room in front of the wall opposite the door based on the clockwise, counterclockwise path you will be following through the room. Place the other microfiber mop at the far end of the room that you will use when you reach your halfway point. Remember, we start at the door and we end at the door. Perimeter floor cleaning and disinfection will always begin at the door and end at the door. Use the leading edge of the mop and an S-stroke motion. The widest part of the frame should be used on the leading edge. This will ensure that the majority of pathogens that you come across on the floor are trapped, captured, and removed. As you continue along the same pathway you followed earlier, working down the first wall, use an S motion or S stroke motion and the leading edge of the mop. As you work your way back, move the items back to their proper position while the floor is still wet in order to disinfect the wheels. The floor should be mopped at a saturation rate that will allow the floor to remain damp for the manufacturer's recommended dwell time. Upon reaching your midway point or halfway through the room, switch out the soil mop for a clean mop and continue on. You can easily step on both sides of the mop without having to bend over. Stamp it on the new pad and continue on cleaning. You are now approaching your third wall, and as you work alongside the third wall, continue the S-stroke motion with the leading edge, ensuring that no area is missed along the perimeter. By maintaining consistent pressure and working within that imaginary box, you're not stressing yourself out ergonomically, you're staying within a safe zone and ensuring that you're getting into all corners, nooks, and crannies as you mop along the perimeter. For the sake of time and for training purposes only, we did not demonstrate baseboard cleaning an entire OR. However, at this time we're going to show you an example of what that would look like, and you would clean the baseboards as you worked yourself around the room. Finish working towards the door in a figure 8 motion. Collect soiled microfiber mops and return to the appropriate location on the cart. Mop frame and handle will be left in the room for a later step. Okay, now you're ready to clean the center of the OR for cleaning and disinfecting the operating room theater. This is the most critical area. Start by collecting a minimum of 2 blue healthcare grade ultra microfiber wipers. Place them in the red labeled bucket and express until there's no more drips. Make sure that you keep the cart lid and doors closed when not in view. Close the door to the OR, which helps to control the air and limit pathogen transmission. As you approach the room center, place the blue ultra microfiber on the table. Take the other one in your hand and begin to pull down and clean and disinfect lights, booms, and anything that's directly over the bed that may not have been cleaned in the perimeter step according to manufacturer's instructions for use. Cleaning principles remain the same. Top to bottom, cleanest to dirtiest, and clockwise and counterclockwise. You'll also notice the increased pressure that is applied to create mechanical friction and disrupt any biofilm or bioburden that may be on the surfaces. Careful attention is given to ensure that no items are missed. Pay particular attention to the care that was given when wet high dusting was occurring. You'll notice that the technician reached up and over the area that they left off on during the wet, damp high dusting. This is to ensure overlap and coverage so that no areas are missed. Friction maintained along with pressure removes bioburden and biofilm. Areas that are even on the back of the monitor, including knobs, screws, fasteners, bolts, hinges, and other connective devices, extra care is placed to make sure that everything is cleaned and disinfected. Each item comes in contact with a healthcare grade ultra microfiber wiper that can trap, capture, and remove, as well as the disinfectant that can then kill the pathogens. Place a clean metal table by the bed to establish a clean area to place the OR procedure table bed components during the disinfection process. By establishing a clean field, you're able to have a safe location to break down the entire table. Every area, careful attention is paid to ensure that nothing is missed. The table is clean from top to bottom. Next, we're going to establish a clean field where we can break down the entire table. Begin on the side of the bed closest to the door. Use a healthcare grade ultra microfiber wiper to disinfect mattress pieces from top to bottom, ensuring that all sides, zippers, and components are wiped, both cleaned and disinfected, including the tags. Then, place clean surface to clean surface when taking components, mattress pads, or positioning devices from the procedure bed to the metal table. With the S motion with the leading edge of the wipe and adequate palm pressure to ensure that the surfaces are properly cleaned and disinfected. Notice clean surface to clean surface is again adhered to or followed. Both sides, including but not limited to arm boards, controls, and any other attachments and base, and allow to air dry. Remember, clean it like you mean it. Remember, high-touch areas like control arms, knobs, buttons, and cords must be properly cleaned and disinfected with increased pressure, as this is the most critical area for patients in the operating room. Taking the additional time to raise or lift or open the bed, it exposes additional components and areas that may get missed had the bed not been raised. This allows ample opportunity for additional cleaning and disinfection of all of the parts, nooks, and crannies where pathogens hang out. Cleaning principles still remain the same. Top to bottom, cleanest to dirtiest, and clockwise, counterclockwise. But you'll notice additional scrubbing is used to ensure that all surfaces where there may be buildup of blood or body fluid may occur. This ensures that every area is properly cleaned and disinfected to the highest standard of the healthcare industry. Thoroughly clean and disinfect all control knobs, cords, and buttons. Remember to consistently and constantly refold the towel so that the wiper has a fresh, clean surface upon which you can clean and disinfect. This ensures there is no cross-contamination and the highest log reduction for microbial removal. By utilizing a clean, fresh surface and utilizing all 8 sides, you not only are maximizing the efficacy of the wipe, but you're saving money and the environment. Clean, fresh surface. Continue cleaning from top to bottom with an S-stroke motion, ensuring that all areas are wiped, cleaned, and disinfected. Ensuring that no areas are missed, continue to move in a clockwise or counterclockwise format. Continuing from top to bottom, wiping in an S-stroke motion with the leading edge of the wipe, ensuring all areas are wiped and none is missed. Switching to a fresh side of the wipe, continue wiping the base of the bed. From one side to the next, ensuring that both sides are clean. Perform hand hygiene at this time, following the CDC and facility guidelines. Don fresh PPE by putting on new gloves. This time, reassemble the bed. Once the entire bed and table has been cleaned and disinfected and all components are dry, reassemble the bed to its proper configuration. Collect all soiled microfiber towels and return them to the appropriate location on the cart. Next step is to perform self-inspection. Perform a self-inspection to ensure that the room has been appropriately cleaned and disinfected. Check for any corrective opportunities that may have been missed. Perform self-inspection by checking under and around the OR table, areas that are inconspicuous but may have been missed. You do this by bending over and getting multiple vantage points from all sides. Check high and low. Keep your head on a swivel, constantly moving your eyes back and forth, up and down from top to bottom. Now you're complete with your self-inspection. Now it's time for center floor cleaning and disinfection. Remove large debris and collect one disinfectant charged microfiber mop along with handle and frame. Any area visibly soiled with small amounts of blood, tissue, body fluids, or other potentially infectious material should be spot cleaned with a cleaner and disinfectant and allowed to air dry. The floor should be mopped at a saturation rate that will allow the floor to remain damp for manufacturer's recommended dwell time. Move the bed and mop underneath. Return the bed to the original position and lock the wheels. Mopping around the OR bed and any area of the floor that has not been cleaned or disinfected. Continue the S-stroke motion, which we also call the microfiber shuffle, working backwards so you're not stepping on any wet floor surfaces. This is the safe and ergonomically correct way to mop. Once at the door, use the microfiber mop to place any minor debris in the dustpan inside the threshold. Bristle brooms cannot be utilized in semi or restricted surgical areas. Collect all soiled microfiber mops and return them to the appropriate location on the cart. After which, we are going to now clean and disinfect all equipment, handles, and frames. Again, following the procedure from top to bottom, cleanest to dirtiest, and clockwise or counterclockwise. Which means for a handle or an IV pole, we would go around in a scrubbing motion as we pull the towel down towards the end. Never should equipment cross the threshold unless it has been cleaned and disinfected. Principles of cleaning the tools and equipment are the same, top to bottom, and in a clockwise or counterclockwise fashion, we uncover all areas of the circumference of the handle. Gripping the microfiber towel as we work towards the bottom, again from cleanest to dirtiest. Cleanest is the top of the handle, dirtiest would be the frame. Pay particular attention to cleaning the frame on both sides. Hold it carefully and steadily in your hand while you take your other hand with the microfiber towel and clean between the two strips of Velcro. Return to cart when complete. Now it's time to perform hand hygiene. Follow CDC and facility guidelines. After performing hand hygiene, remove the wet floor sign, but only after the floor has dried. Close the door to the OR theater, maintaining positive air pressure. Now it's time for the final inspection. How did we do? Excellent, because we followed the authorities having jurisdiction for proper cleaning and disinfection. Remove consolidated trash and linen and then perform hand hygiene. After which, record the room as complete and clean. Each day, if room is used, the best practice is to display a sign that marks the room as clean and ready for the patient day. This is best practice AORN guidelines 12.3 under quality. Perform process monitoring as part of an overall environmental cleaning program. which includes compliance with regulatory standards, review of manufacturers' products, IFUs, and monitoring cleaning and disinfection practices and reporting and investigating any adverse events. 12.3 AORN Guidelines measure cleaning practices using qualitative methods for visual observation of the cleaning process, visual inspection of cleanliness and fluorescent marking, and quantitative methods such as cultures, ATP monitoring. AORN Guideline 12.3.2 provide feedback of assessment findings to personnel and leaders.